everyone, it's Dr. Lisa here from Errol Street Chiro in North Melbourne. And if you or someone you know is getting quite a lot of lower back pain and leg pain and you're not sure whether it's a disc issue, then stick around because we get lots of these questions in the office. Do I have a disc issue? Do I need to do anything about it? Should I be getting an MRI? Who do I need to see? And when do I need to go to that hospital for an operation? So now, what kind of symptoms do we see with disc problems? So a lot of the times, obviously, it's that lower back pain. It can be quite severe in nature and quite restrictive. We can then be seeing pain down into the buttock, into the leg, and all the way down to the toes. There might be some tingling, some numbness. There might be shooting pains. There may even be some weakness in some of those muscles and joints of the lower limb. So it can get mild to quite severe in nature. And, in these interesting times, people are a little bit more concerned about going anywhere. So just to help you out, this is definitely not to diagnose you over a video, but it's just to give you a little bit more information about what might be going on and where you should be perhaps going to get this sorted if you need to. So some of the causes are quite obvious if there's been a severe fall, if it's a sporting injury or a fall outside or off a ladder. Those kind of injuries can actually occur through those incidences, and if that's you, then definitely do go and see your practitioner, whether it's your GP first or a chiro or an osteo if you are in that severe pain after a fall. Obviously, if you feel you've broken something, you definitely need to go to that hospital. Now, the other thing is that people can be bending to pick something up, and all of a sudden they've got from nowhere apparently this severe pain, and they're just kind of baffled. Well, could this possibly be a disc issue? And sometimes yes, because of changes in that spinal, the biomechanics and the loading over time, and something just like twisting or bending, something quite innocent may just trigger off that nerve pain. So some long-standing structural and biomechanical dysfunctions in that back can cause that. So normally our spine should have a nice forward bend in that lumbar spine of about 40 degrees. And what happens is that if you get a tilt in that spine, or if you get a loss of curve, then we're starting to load up those structures, including your discs, in an inappropriate way that can over time cause some wear and cause that disc to herniate or to prolapse, and then perhaps even hit that nerve. Okay, so those are kind of the long-term issues that we see that can result in that severe pain. So we cannot diagnose a disc issue in our office. We can have an idea that it possibly is through our neurological and orthopedic tests. The only way we're really going to find out is if you do have an MRI. So it is really up to a practitioner who is highly trained to, or obviously a GP, to let you know whether it is warranted to have that that MRI imaging done. So what do we do about it? Do we, even if you've got pain down the leg, do you need an operation? Well, look, the operations are a last resort. So if you do have such severe pain, let your practitioner know, let us know. We're happy to answer any questions that you ask. So and also if you have someone at home or someone that you know that is suffering that may need to hear this information, just tag them below, and they do feel free, or they can feel free to message us privately as well. All right, guys, we hope you found this video informative, and we will see you all next time. Bye for now.